Know it talks. All right. So we're going to be starting with compression of the arm and then working our way down to the leg. All right. So the first item on the list says that it's from the biceps, but I'm actually going to start with the deltoid instead. We're going to start at the top of the arm and work our way down. All right. So when I treat any sort of injury, to the arm, I often start with compression, just because it's usually a little bit more comfortable. I can go really slow, and we can get a whole lot done. I will add in some Swedish, but I rely a lot on compression when I'm doing any sort of treatment work, but especially of the arms and legs. I find it to be particularly effective. So we're going to start at the top of the arm. We're going to start with the deltoid. And I'm going to just cup the deltoid in my hand and push toward the table. Is that okay? And I have my other hand resting on her forearm, but I'm not pushing her down. I'm not holding her down. If she wanted to move her arm, she could move her arm. It's just a resting position. I'm not making it creepy.
You're not squeezing or anything.
No, just resting. And then I will work the deltoid in a couple different positions. So now I've scooped around the back so that I can get the posterior section of the deltoid. Yeah. Yep. I'm cupping it kind of like that. And I just hold for a little while and let it kind of melt out from underneath. The deltoid can often be pretty painful or sensitive, especially the posterior of the deltoid. So now I'm going to work a little bit more towards the front. And here, I'm angling my pressure at a diagonal instead of just pushing like straight into the table. This feels uncomfortable for me, and I'm sure it's fairly uncomfortable for Jade. So we're just going to go at a little bit of a diagonal. And I usually go over in the same spots a few times. Every subsequent return to that same spot, I'm getting a little bit deeper. Of course, if you have a time limit and you need to move fast and you don't have time for really thorough arm work, this is just as easy to staple it to the tissue real fast, do some compressions along the arm, get into the hand a little bit, and then move on. All right. Okay, so now we're going to move more into the biceps. And I like to work the biceps and triceps at the same time. doing a compression like this, where I'm using the heel with both hands and squeezing with my fingers. And you may need to pick your client's arm up in order to get your fingers under their arm in a comfortable spot. Because if you just slide your fingers under without lifting, sometimes it can get kind of pinchy in that very thin skin there. So here I'm finding more tightness more in the biceps, so I'm moving that hand a little bit more. There's not so much going on in the triceps. If I'm doing really detailed treatment work for the arms, and sometimes with the legs too, sometimes I will do it seated, just because the angle of my pressure is a little bit different. So say I feel like I need to work more like horizontally with the table or perpendicular with the table than straight down, then I can angle my pressure accordingly. All right, what's the next thing on the list? I think it's a pin and stretch, right?
Yeah.
Bicep straight leg, the bicep straight leg, short
Okay. Is this side still okay? Pepper? All right. So you're going to pin and stretch the biceps. First, you need to shorten them. And then you're going to hold it in place.
You're pushing it out.
I'm pretty much just pushing straight down. I'm actually just not even really pushing straight down. I'm just kind of squeezing in towards the bone. And then move the arm, extend the arm. And if you feel like you lose your pin, you're going to have to bend the arm again and start all over. By the time you've extended the arm, if you're pinning here, you're not going to get any sort of stretch. What we're doing is like manually shortening the muscle so that we can stretch it farther than its normal range of motion.
Ergonomic range, which seems to be better for you. For sitting or sleeping.
For pin and stretch, standing. There's some pin stretches for the forearm that I actually feel work better sitting than standing, just so I can get like the right angle. But I'm also tall, so that may be part of it. All right, what's the next part of the list?
Stretch and compress forearm, focus on bicep, brachii, and brachials. Something okay to it's okay to move your arm around for better access.
Okay. So we're gonna do compression of the forearm. I'm gonna raise the table up just a little bit.
Wrong.
All right, so there's several different ways that you can compress the forearm. I like to do one hand under the arm, and again, I lift the arm and place it in my hand, because if I just slide underneath, especially with dry hands, it can get a little bit pinchy. So I have one hand underneath and one on top. and I can squeeze at the same time.
What if you have smaller hands and a bigger body?
Then you might have to do a couple different hand holds.
What are you squeezing there? Like, are you squeezing like top to bottom, or are you squeezing sides?
So I'm squeezing the top and the bottom, so the flexors and the extensors for the forearm. So here, I'm squeezing like this, and I mean, you can do it just by itself as well.
Is there a way to do this compression to where the client doesn't feel like keeping track, like they can get out of time? Because I know that's something that we based on somebody wants to exercise that.
With that, it's mostly, so there's this, when I'm doing compression in this area, it's not quite the same as holding their arm down. If I were holding her arm down, it would be potentially more triggering. If just the squeezing of the limb were potentially triggering, then I would do it just one-handed.
Yeah, but the way you're doing it, like you're lifting, it's more like a, hey, come on, not a face thing here.
Right, right.
Instead of time, can we really get into those muscles a little bit more? Like I like to use my thumbs or knuckles. I felt some tension spots, especially anteriorly. I know that.
I would recommend seeing how much you can get done just with the compression, because I think it'll surprise you how much that you can get done. So like right now, just with this hand, depending on how I'm angling, depending on the direction of my pressure, I can do really detailed work in the forearm. Even also, kind of like when we did the prone calves, where you kind of separate the gastrocnemius. You can do something similar with the forearm, where you just press on either side and just kind of spread your hands a little bit, just to stretch it out. Mm-hmm.
Do you only do this over the skin, or you could do it like over clothes?
You can do it over clothes. My personal feeling about compression is that, you know, Jake can be wearing a full-on like snowsuit, and I should be able to get just about as much done through that garment as I can with her undressed or through regular clothes. The exception being jeans, that does kind of limit things a little bit, especially if the client is like wearing a belt and they don't take it off for their massage, which I've run into many times. But yeah, you should be able to work through clothing, no problem.
I've never had to work through a snowsuit before.
I haven't either, but I'm prepared after all these years. I usually talk to them about it beforehand and let them know that it's, you know, to their level of comfort and explain what that means. So for the most part, I won't make any suggestions of taking anything else off. The exception being that if I'm going to be working with lotion, like say they're fully dressed, but we're gonna do neck and shoulders, I just double check with them that we're gonna be using lotion. And, you know, I might get it on their clothes, get it on their shirt or their bra. Bras are expensive. We don't wanna be getting oil stains on those babies. They cost a lot of money. So I will check in with them about that, because some people, they're like, oh, these are my workout clothes, I don't really care. And sometimes I will just opt to not use lotion and just do compression for neck and shoulders if they're not comfortable and if they don't want to use lotion in that area. Yeah, anything else about that? Okay. What's the next thing on the list?
All the clients and she does
So when we are lifting a client's arm, we've got to be careful of their wrist. If they have any sort of wrist injury, you don't want to be putting like the full weight of their arm just in their wrist. So I usually like support the wrist just a little bit while I'm doing the shakeout. And you'll notice the shakeout is coming like all the way from my feet.
And your possible socks.
And my rainbow. You could. I find the up and down movement a little bit more jarring personally. So I tend to just do like a jostling side to side movement. I also like to often work on the hands first and then do the arm shakeout. All right, is hands the next thing? All right. So when we get to the hands, I wrap my fingers around. You'll notice that it's a lot of like wrapping maneuvers around the arm because it's the right size to be able to use both hands. So I am supporting like the meaty bits of Jade's hands with my fingers. And then with the heel of my hand on the top and my thumb supporting the wrist, I spread her palm open. Is that pressure okay? Yeah. I'm not like kinking her wrist or keeping everything real straight. And I'm just
Are you pulling?
opening. Yeah, I'm pulling in opposite directions. Right. Yep. Nope. Just opening things up. And then I will usually gently support the wrist because this having her hand all the way on the table is gonna mess with my body mechanics. So I'll just gently support her arm so that she doesn't feel like she has to hold it up. But I'm also not grabbing in a creepy way. And I will just squeeze her fingers. Obviously, if somebody is wearing a ring, you're not going to squeeze right on the ring. I think that earlier in that list, there's like a fingertip squeeze.
The two sides on the nail bed and one on top.
So I like to do just the whole finger. It may look a little weird, but I love it when people do this for me. So after I've given them a little squeeze, opens their palm up, I will support their hand, but I'm using their elbow against the table, not pushing, just supporting it at that angle. And then I'm in a good working position to work on her hand. You can also do this seated if you want. But especially when you're trying to work fast, this is a big position so that you can just stay standing. And in this spot, I'm just kneading a little bit with my thumb.
So it's kind of like the diaphragm massage on the toes. Just going,
Similar. I'm not quite going up to that line. So like the equivalent of the hand would be like right here. I'm just getting into these often overworked muscles of the thumb. I will also do like a pincer grasp with my fingers here and just squeeze. Completely escaped me. There's a bunch of pollicis muscles in there. Pollicis means thumb, so the flexors and something.
We don't really study those ones by then.
So, oh, go ahead. As I'm in here, if I feel like there's a whole lot of tension, I can just do a little bit of traction, just moving the thumb out a little bit to add a little bit more space in there. And then I can sink my fingertips right in there. If I've done like a deeper or pointier work around the thumb, I usually just try to like squeeze it out a little bit, give it some love. And then I will do a similar kneading with my thumb on the other side. And what I like to do just to get in really thoroughly, you know how we did our fingers in between the metatarsals? So we're going to do the same thing, but with the metatarsals.
I've been thinking of this as just like doing it.
Yes. Yep. The arms and the legs are extremely similar, and many of the same techniques will work for both. You can actually do reflexology on the hands as well. I am not really familiar with that kind of reflexology. And I'm just moving my fingers back and forth, just really gently. Unlike the foot, because we have opposable thumbs, the equivalent to this release here is what I was doing over here with my fingertips. Because unlike with the foot, you don't have your big toe right next to you, so you have an odd number of spaces to work in. And then lots of times I will end just with a little squeeze. Just set that arm down gently. All right, what's the next thing on the list? Zephyr, do you need me to move to the other side? Okay, so the area that we're avoiding is the upper medial thigh. So we're not gonna get in toward the pubic area, anywhere near the genitals. You can get around in here, down lower, where it's not potentially creepy. The adductors are there, and they often need a lot of work, but we're starting with the quads. So kind of like how we did the hamstrings, basically the same thing with the quads. Is pressure okay? So you may notice as you get around to the lateral side, we talked about the IT band when we were working on the hamstring. You're gonna have a lot of access here to the IT band. And you may actually feel like a textural difference between the muscles of the quads and that huge sheet of tendon here.
So with the IT band, you can get right next to it, but don't put too much pressure on it.
You can put pressure on it.
Is it when it gets up towards the hip flexors or whatever, that it gets really kind of more tender?
I would say it's actually more toward the knee, where it gets more tender. And that's one reason why I really like compression for the IT band, because I think it's a little less painful to sink in there than if I was doing like stripping, like using my fist, just like really releasing it very aggressively.
Do you ever use forearm in this area that kind of keeps your head out to the side?
You can. Yeah, if you wanted to use forearm, you could just sink in here. Yep. But I like to do just a nice squeeze. We're doing, 3 dimensions, so we're not just doing one line down the center of the quads. We've got way more real estate to address. So we'll do that for the- Yes. This also helps having the bolster here. If you have a client who has a tendency to like hyperextend their knee, if their leg was flat and I were pressing down like close to the knee, it could be like going backwards and don't want to do that. Yeah. Working the IT band can really help with that. I'm just lifting the knee a little bit so that I can get a good angle right next to it. Jade, is this tender good? Feels good. It can be tender in this spot.
So what if somebody has a previous injury that's still, but they want you to work?
It depends on the injury. So, you know, if somebody were like recovering from, you know, a sprained knee or something like that, you know, you could work around it depending on how far out it is from the initial injury. But if it's not in the acute stage, you can work around it to their tolerance.
And like an older patient, somebody who has maybe arthritis because getting all the way to
And it often feels really good, especially with things like arthritis, because it can take a lot of that pressure off of their knees. Okay, what's the next thing on the list?
thumb, ST, and JB meridian lateral to tibia and tibialis inferior, and then on femoris.
Okay. Perineals.
Perineal.
Okay. So when you get to the lower leg, you're going to have the tibia that you can palpate right here. But right next to it needs some work. Tibialis anterior is often super, super tight. And it's the perfect size to just stick your thumb right in there. Sometimes I'll also just use like 2 thumbs like this back and forth. But if you really want to get in there, it's the perfect size for a thumb.
Really compressing on the other side. Are you using the base for a palm as well?
I'm using the base of my thumb. You can also use the heel of your hand for this spot. So like here, I'm using the heel of my hand and also my thumb, working kind of in a straight line right next to the tibia. I'm using my other hand to just add a little bit more pressure on the side where my thumb is. And you work all the way down to the ankle. Another thing I like to do with the lower leg is like cup the calf in my hand and do the exact same line, but with the heel of my hand. And you can get in here with both hands too. And just squeeze around the calves. All right, what's next on the list? Okay, so we've done this a couple times, I think. We did it with foot massage. And you can do this sitting or standing. Like if you were going to transition into a foot massage, you could do this sitting if you wanted to. But you're going to get right behind the ankle. If I can show you like that. We're just going to support the ankle here, but the heel of my hand is going to be on her foot, the top of her foot. And we are just going to rotate. And you can see a difference on the leg that I worked versus the leg that I didn't work, especially around like the hip area. There's some restriction still there. And just this movement can really feel good on the hips. Because you're loosening the hips from the feet. All right, what's the next thing? Okay, so, and then from here, you can transition into foot massage. If this was going to be the end of your massage, I like to give a little bit of attention to the feet if you haven't already done it. Just give a couple nice squeezes. But then your resting position can just be like hands on the top. Okay, any questions?
There's two more.
There's two more? Okay, what else have you got? Okay. So you guys already know the feet stuff. So I'm not going to demonstrate that as well. All right, any questions about any part of today's demo or anything from yesterday that you would like to see? I know Lucy and I have slightly different techniques.
So when you were doing the rock motion of the legs, would you do that on the planking moment?
I'm going to go with a no on that one, but it depends on how far along into the pregnancy they are. If it's early pregnancy and they're still able to comfortably lay on their back, then I would feel comfortable doing that. But if it's later on in the pregnancy and they're relaxing and started loosening all their joints, then I wouldn't do it. But also by that time we would be doing side lying. So it wouldn't really come up so much anyway. Any other questions? You could do one at a time. When you do both together, it gives you an opportunity to compare each side. So if I were going to, let's say I started Jade supine and we were going to switch to prone. If I observed both sides, and let's say I worked on this leg, but I'm still noticing restriction at the hip, that'll be my clue that when I flip her over, that may be an area that needs a little bit of extra attention. But you can just do one side. You can also just give it a little shake if you want to. Notice I'm supporting all around the ankle when I do this. Some people have weak ankles. By someone, I mean me.
Another question, if you're, if somebody has back pain, low back pain, would you do this?
Actually, yes, especially this one, because a lot of low back pain is coming from the glutes and hips. So to really open that up and really like gently activate that joint and get that movement going in there feels so good. When I was getting massage for my back injury, that was my first introduction to massage, and I loved that part. She would usually do a little bit of jostling, and then we go into some assisted stretching. Oh, it was wonderful. Anna, did you have a question?
Just pertaining to today, if we get down to the bottom and, wrap up like this, and there's still time, we're not necessarily going to pull on the massage type of thing per se, but still wrap up to the top.
Yeah, you could start from the top and work down again. Or you could transition, like if you have like 10 or 15 minutes left, you can transition into foot massage. But practicing the compression supine is a little bit different than when you're prone. Because when you're prone, like you have the whole back and you can really like lean into it. And when you're supine, it's like, it's all limbs for the most part. So it does feel a little bit different, but also that gives you a great opportunity to do some detailed work because you'll find all sorts of stuff going on with their limbs.
So if they have like back problems, but it also comes up to the side, we should work on it when they're supine.
I would do both. I would work on it supine and prone. If I just had very limited time, like say it was a car accident case, and they also had like head and neck stuff going on, then for maybe the first session or two, I might, work mostly prone and then do neck and shoulders supine, just to kind of save some time. But I definitely want to get into the hip here and the quad, because depending on the angle of the pelvis, the quads could be weak or they could be like completely overused. So you want to make sure that, if you want to really thoroughly address that low back pain, that you're getting all along the glutes, into the hips, hamstrings, and quads for sure. All right, anything else? All right, that's it.